In our next segment, we turn our attention to an important partnership between Genesee Health Plan and Senior Medicare Patrols, a program dedicated to empowering Medicare beneficiaries, their families, and caregivers to safeguard their health care. Through outreach, education, and volunteer engagement, Senior Medicare Patrols help prevent, detect, and report potential Medicare fraud, errors, and abuse. This critical collaboration protects the well-being and financial security of older adults while ensuring that Medicare dollars are used appropriately. Let's explore how this partnership makes a real difference in the lives of seniors.
My name is Shannon Cezak. I'm the Communications Coordinator for Genesee Health Plan. Genesee Health Plan provides healthcare coverage to the uninsured in Genesee County. That includes enrollment into Genesee Health Plan, Medicaid, Medicare during open enrollment, and healthcare.gov. Today we're going to talk a little bit more about Medicare fraud, and we're going to hear from our friends at Senior Medicare Patrol.
My name is Oratile Sijier, aka Rati. I am the director for the Senior Medicare Patrol program in Michigan. Medicare fraud occurs when dishonest providers and scammers bill Medicare fraud for services that were not provided. Medicare beneficiaries should be concerned about Medicare because it costs the system a lot of money. In Michigan, there's about 2.2 million people who are on Medicare. Now, nationally, there's about 60 million people that are on Medicare. Now, if you look at that, we're looking at about $60 billion that is lost to Medicare fraud. It affects everybody. We all pay into the system, hoping that someday it will serve us well. We should all be concerned about Medicare fraud because the cost to the system affects the premiums that we expect Medicare to be able to improve on the services, but instead of improving on those services, money is wasted on payments that should not be done. So we all are invested in making sure that we're reporting such instances when it does occur. Some warning signs that Medicare beneficiaries can be looking for would include misrepresentation of government agencies. People misrepresent Medicare. They'll call or they'll visit Medicare beneficiaries claiming to be Medicare representatives. They can also claim to be Medicaid representatives. They can also claim to be Social Security. And lately we've also heard of some calls where they're claiming to be pharmacy representatives, and all are targeting the same information, which they are looking for people that will give them their phone numbers, their addresses, their doctors' names, their doctors' addresses, and which then results in the scammers being successful in billing Medicare fraudulently. What is going on with Medicare fraud currently is we're seeing a lot of phone calls that are coming in concerning catheter charges. Now, this one is a silent one because not everybody receives catheters. So by the time someone realizes what is going on, they have anywhere from 3 charges to 10 charges. So you're looking at about 10,000 to 20,000 for any given person. And hence, if you're looking at about 60 billion people, that is a lot of money when they're being successful with this information. So then part of what happened is at the beginning of the year, we had a lot of these phone calls, and what seemed like a scam that was happening in Michigan was actually happening throughout the states. And so one of these companies, it ended up being in the $100,000s of dollars just on catheters alone. Other scams that also have the same impact are the durable medical equipment. People are receiving braces, knee braces, back braces, ankle braces that they have no need for. And so it requires that Medicare beneficiaries be diligent in looking at their summary notices to find out if there's any activities for services that they didn't receive. Other examples of Medicare fraud include DNA testing. Now, this scam affects not only the beneficiaries but also their healthcare providers, because these scammers are targeting both the professionals and the beneficiaries. They want the signature from your healthcare professional, and they also want you to consent so that they can send these unneeded supplies. So we're getting calls from family physicians who are being harassed for signatures for supplies that their patients do not need. And so it does affect not just the beneficiaries but as well as their healthcare providers. So the Senior Medicare Patrol is mandated to provide and empower and assist Medicare beneficiaries in identifying fraud. We support beneficiaries and through education, through counseling, through outreach, we help Medicare beneficiaries to be able to prevent, because that is the first step that we need our beneficiaries to be able to do, prevent Medicare fraud. And of course, not 100% are we going to be successful, but we also want them to be able to detect when it does happen. And if they discover that it has happened, we want them to be able to report Medicare fraud, because this is how we stop. So the Medicare beneficiaries are the first line of defense when it comes to Medicare fraud. The Michigan Medicare Assistant Program is the program that is mandated to provide these services in Michigan. And in order to do this successfully, we partner with our community agencies that are already serving Medicare beneficiaries. And Genesee Health Plan is this partner for us in that they have been helpful and they are spreading the word on Medicare fraud awareness and educating beneficiaries on how to prevent and how to detect and how to report. So it is a community effort, and the partnership with Genesee Health Plan has been very instrumental in that regard. So when people suspect fraud or believe that they've been targeted, we encourage Medicare beneficiaries to call our hotline. Our hotline is 1-866-MICH-SMP. That's the easiest way to remember it, MICH-SMP.